Hello, everyone. It's about 1 minute before the top of the hour, and just gonna make sure we have as many people in at the beginning of the webinar as we can. I just want to let you know that you should be able to hear me if you've joined so far, and you should be able to see my screen. I hope that's true, but we will start properly in about 1 minute or so. Thanks. So thanks again for joining today's webinar. Today's webinar is about how to grow your practice, and we put in quotes safely in 2021, and there's a reason we put that in there, and I really appreciate anyone's time as we go through this time of a dental practice, all of the changes that have occurred for you and your practices, all of the things that you have to do on a daily basis, even being able to attend this webinar. I really appreciate you taking the time, and I'm going to talk about growing your practice in 2021, and it might seem to be a tough topic to discuss right now. And you might even say, what do you mean growing my practice? I'm just trying to make it through the day. But I believe that you'll find this webinar insightful and helpful to your practice, especially even right now, in terms of the way you think about your practice and how to grow it. Every week or so, I take a look at a survey that the American Dental Association has been putting out since the beginning of the pandemic, and there's a few things that are really important to take a look at just as we level set where dental practices are right now. And this is a nationwide study, and of course, yours may be your practice may be different, but on average, only 40% of practices are back to normal. Really, and normal meaning open and business as usual. 75 to 80, or most practices are operating at 75 to 80% of capacity. And that has a material impact on the way you think about patients and the way you think about your practice and the way you plan for the future. If you take a look at some of the other components, in terms of patient volume and collections, only 20% of practices are operating at close to 100% patient volume, and no more than 50% of them are reaching 85% of collections. That's really an impact on a dental practice and the viability of a dental practice as you looked into the beginning of 2020 and your plans for 5 years. It's had a major impact. The reasons for this, of course, are the pandemic, but the reasons are varied about why dental practices are only operating at 75 to 80% of capacity. In fact, this is what we hear from many practices, and it's really a conundrum. My schedule is full. I can't take on any more patients, but yet I'm only operating at 75% of what I did before the pandemic. Or it takes me an extra half an hour to complete an appointment because I need to change out my PPE. I need to spend more time discussing issues with patients. I need to, of course, sanitize the operatory and then hope that the next patient is on time and ready to go so that I can get them through. Here's something else we're hearing. Many of my patients are still not coming back for their appointment. And those that are coming in have more dental and, of course, health issues because they haven't been in the office for a year or more. So all of these are converging, all of these issues, the concept of I can only take on so many patients, so I'm full, but I'm not full in terms of collections, in terms of the volume that I need in order to have a healthy practice. And all of those converge to really have an impact. So as we're coming into this last stage of the pandemic, a lot of practices, of course, have adjusted their processes. First thing you did was adjust your process to ensure a safe environment and high quality care. And the dental community really should be applauded for the work that you guys have done to make sure that you have a safe environment. However, some patients are still not sure of the process of getting safe dental care. As we think about it as consumers, every time I do anything, I have to think through it and I have to make sure that I understand what the process is. And dental practices are having to continue to adjust to staffing levels, changing staffing levels, patient requirements, and of course, financial issues, as the impact on the pandemic is having an impact on revenue and on patient volume. You're having to make adjustments in a number of different ways. And here is what probably the most telling slide, and I hope you can see this, and if not, take a look at it later. The impact on dental practice revenue is material. The ADA asked this question in the last month: have you taken any of the following measures to maintain financial sustainability of your dental practice? Really great question. Here are the top responses. 32% of practices raised fees. Of course, this provides a lot of much needed income, but it impacts the number of patients that can accept a given treatment plan. I don't have as much money as and most people don't. And so, and insurance isn't covering as much as they used to. So now many patients have to think about whether or not I can actually accept that treatment plan. 18% of dental practices reduce their dental team's hours or downsize their dental team. That puts more time pressure on the remaining staff. Of course, it reduces the cost, but if you have more time pressure on the staff that's there, it impacts the number of patients you can see in a day. Many dentists have had to borrow money, some have even closed. And so practices, and of course your practice, is doing what it needs to do to reduce costs and increase revenue. But there's one thing that isn't on this list that I would like to explore today, that I was surprised that it actually wasn't anywhere on this list, even in the other category, and that is this. I would like to see more practices say this: I made my practice more efficient and increased my patient flow and my revenue through my practice through automation. And today I'm going to spend a lot of time talking about how you can use automation and digital solutions to increase your patient flow and increase practice revenue, getting additional patients into your office. As a matter of fact, practices, some of them are discovering ways to streamline their operations to get more patients through the practice. If you could increase your daily patient count by 1 per day, or 20 more patients in a given month, think about that, 200 patients per year, you know that it'll have a major positive impact on practice revenue. And many practices are really looking at their processes and using digital solutions. Many of you have already done some of the things to get more patients through the process, but some of the key areas are, first of all, you need near real-time information for patients. You cannot have them be confused about when you're open, what your protocol is, and you can't take a lot of time figuring that out or communicating that. You need touchless onboarding and offboarding for everything that you do, because that increases the safety and speeds the process through. You need to automate a lot of formerly manual tasks, because as you see, you have even maybe a smaller staff size or maybe a smaller team size. Many dentists are doing things that you haven't done in years just to be able to get through. And the use of digital solutions to communicate with patients is really important. And so today, I just want to spend a little bit of time talking about the patient journey. And I've talked about this before, but more and more, I'm thinking about, and our company and our team is thinking about this dental patient journey, starting with the pre-visit. When you think of it, it's really in 3 parts. First is the pre-visit. That's the time the patient is actually interested in making an appointment up to the day before the appointment. The actual appointment day, everything from the time they arrive to the time they leave, the post-visit after they leave. And if you think about all of the things that a patient will have to go through or thinks about, or that your practice thinks about, you realize that there's a lot of friction points in that journey. A patient, first of all, has to understand the safety protocols. They have to discover and determine when you're available and what procedures you're available that you actually are doing right now. Sometimes I may need a cosmetic procedure. Are you doing that now? I need to be able to discover that. Of course, I have to make an appointment. When it's my appointment day or the day before, I have to confirm my appointment. We have to make sure that I am coming in. I have to fill out my patient forms. I have to answer the COVID pre-visit questionnaire. I have to announce that I'm arriving because a lot of you have off-site or parking lot requirements. I have to then have a visit with the doctor. I've done all this now. I get to have the visit with the doctor, and you as a doctor or the practice now has to help me understand my treatment options. I have to decide if I'm going to get this treatment. Then I have to get the treatment, and that's all for the appointment day. And then after the visit, I have to pay my bill. And then you're going to want to do treatment follow-up. So all of these, if you think about it, are potential time wasters, potential blocks in the flow of the patient journey going through the system. And what I want to communicate is that you can use digital solutions to automate that journey. And I'll talk about each one of them, but think about your website, your patient communication software, all along, all of the things and tools. Some of them you may already have, some of them you should seriously consider investing in so that you can help speed the patient journey. Again, this is not about making them feel good or making you feel good. It's about being able to increase your practice revenue and reduce the amount of time that a patient has to spend in your office in order to get proper care. So thinking about the pre-visit, I'm going to talk about five things. Number one, automated patient recall, and we'll talk about that. Using your website to communicate, online appointment booking, online patient forms, and virtual consultations. All of them can really help improve the patient flow before the visit. So first of all, I hope you have and are using your automated patient communication system to inform and encourage your patients to make their appointments. You no longer have time to have someone on your team with a reduced staff to make calls, manually send out emails, check in on patients. And I actually, my dentist is old school, and I sometimes get a call from them to tell me to, don't forget your appointment is coming up, or, let's get your appointment scheduled. You just don't have time, but you have or should have a communication system that can automatically send out reminders for patients who haven't been back into the office. So it's automated because you don't have to have a lot of people create and manage that communication. It's comprehensive. It automatically pulls your list of active patients right from the practice management system. So all you have to do is say, any patient that hasn't been in the past 12 months, send them an email. And that 2 clicks of a button, you can do that. And you can do that through text, emails, postcards. All of them can be done. Here's some examples or some things that you should consider. As a matter of fact, there is one other benefit. You can use your reminder system to automatically let patients know if you're closed. So I talked to a dental friend of mine yesterday who's in Texas, lives in the Dallas-Fort Worth area. And we were just talking about the winter storm that's hit over the entire Midwest and in Texas especially. But if you're located there, and he said, yeah, my practice is closed for the week. I've been closed all week. And I said, did you let your patients know? And he paused and said, oh, I didn't even think about that. Well, I assume they know we're closed, but maybe they know you're closed, but they don't know what the next step is. Are you going to call me? Am I supposed to call you to reschedule? If you could use your automated patient communication system to instantly send a text to any patient that was supposed to come in that day, today, this morning, and say, we're closed. Please know that we will call you or reach out to you or send you an email to reschedule your appointment. Imagine the stress that's taken off of me, the lack of back and forth of me leaving you a voicemail and then your team having to go through that voicemail, and you can do that all from the comfort of your home. So I'd like you to consider making sure that this week or over the coming weeks that you send an email on your safety protocol, that you send an automated email to patients who haven't been in the practice for the past 12 months. You may even consider a postcard to your patients, thanking them for their loyalty over the past year. Here's an example of a postcard that's really highly used by our practice, especially during benefit season and now into the new season, to let them know this is a place that you want to be. So I really encourage you to use your automated communication tool, first of all, to get those patients who haven't been scheduled to come back in. One of the things that I read a lot about is that dental practices in the dental community is concerned about the health of our country's patients or our country's citizens, because we have reduced the number of times we're going to see the going to see the dentist, and you know that that is a potential major long-term medical health care issue. So being able to get your patients to come back is really important. Once the patient really decides that they want to come into the office, you should use your website as a communication and conversion tool. Make sure that your banner at the top of the website shows what that you're open, that safety is important, that you have a COVID procedure, and then you can put that COVID procedure right on your website so that they can see it, that they will let you know, that they will know exactly what their role is in their visit with you when they decide to make that visit. We all know what the requirements are to go to Costco, to go to the grocery store, to go to the gas station, depending on your state. Some, states don't have that big of a requirement, but here where I live, I know all of the rules. I know when I need to have my mask, when I don't need to have my mask, when I need to bring the hand sanitizer. Letting them know what your protocol is, since they don't visit as much, is really important. The next thing is that the patient now has to schedule an appointment. I have to make an appointment for my next visit with my dentist. And here's what may be happening, what's going to happen to me, and what may be happening to you in your office. I need to call the office. I'm going to do that at 5 o'clock because I didn't know that you're closed at 4. And so maybe I get a voicemail. The next day you call me back, but I'm doing my seemingly endless Zoom meetings. And so I didn't answer the call. And then I call you back. And then they tell me that the front office tells me the available appointments, and I have to look at my calendar. The friction and time wasted for your practice is almost mind numbing. Oh, and by the way, do you take my insurance now? Oh, please hold. And that level of communication going back and forth, it takes up so much time even before a patient comes into the office. So I encourage you to use online appointment booking. You can streamline your scheduling, you can control and customize the availability, and you can put online appointment booking right on your website. A lot of practices are concerned about putting their calendar on the website or making it available to patients, but there's ways to control your availability. So you have your standard level of appointment booking, but you can use an automated tool or an online appointment booking tool like the one we have, and you can say, I'm just going to make 3 hours available every day of the week for 2 of my providers. That's open time, and I can get more people to fill in that time during maybe they want to fill this in on a Sunday or a Saturday. And so they easily go in, pick the actual time that they want, choose the provider that they want, and what you will get is a message. So when you come into the office on Monday morning, or you can do this easily from the comfort of your own home, you can decide if you want to accept or reject an appointment. But when you accept an appointment, the patient automatically gets a notification that says your appointment has been accepted. We'll see you then, and they will get the reminders and the notification and all of the information that they need, all at the push of a button. Imagine the amount of reduced call time and back and forth time with a patient if you can fill your calendar at the click of a button, and it helps at the time that the patient is available. Now, I have an appointment. You have to make sure that patients complete their patient forms online. There are a few major time and money issues, a number of them, in a patient appointment. Number one, having a patient come to the appointment without a completed health history. Filling out a clipboard, or even if you have it on an iPad, you don't want to clean that thing and have pins that are clean pins and unclean pins or unsanitized pins. Number two, having a patient come to their appointment only to announce, I'm not feeling as well today, or having a patient not feel well and then not notifying you until 10 minutes before the appointment. calling you and saying, by the way, I'm not feeling well today. All of these scenarios represent lost time and even an empty chair for an hour. And having an empty chair for an hour loses the entire day's revenue profitability. Using online patient forms to solve these issues is really important. Not a fillable PDF, but an interactive form that captures critical patient information. As you can see here, patient information, registration forms, health history forms, all the exam forms, my insurance information. Maybe they need to fill out a consent form, and of course, the COVID questionnaire. And we have seen practices requiring patients to complete their patient forms online before their appointment and the coronavirus or COVID-19 questionnaire no more than 24 hours before the appointment. The benefit of this to your practice is you get to see this information the day before they come in. Of course, you will have check-ins on COVID questionnaire when they come into the office, but you can weed out any potential problems and understand what their problems are before they come into the office. Because if by any reason they can't come in on Tuesday morning, you can backfill that appointment with someone else. Another major consideration for patients is whether a given practice can actually help them with a procedure. Does your practice do cosmetic dentistry? Do you do implants? I can see it on your website, but can you solve my problem? We patients know that most dentists can do cleanings, most can handle emergencies, but what about the cases that require a little bit more review and complexity? It's time consuming for a patient to call and talk to your team in your practice about their problem, or try to ask a bunch of questions and then decide if this is the right thing. I can totally imagine calling in and saying, well, so I have this little problem on my right tooth and I'm wondering if you can take care of it. Well, tell me more. And around you go. And oh, by the way, do you accept my insurance? And for you, you don't want patients to come in and not accept treatment. That's probably the worst thing that can happen. One of the solutions you can employ is virtual consultation. With this digital solution, a patient can show you their problem on screen at the comfort of in your own time, and you can review the issue in your own time, maybe in the evening. You can recommend treatment or do a live consultation and even tell the patient an estimate of the cost, all without them having to come in. And many times the virtual consultation is billable to insurance. So a virtual consultation can increase your revenue, maximize your patient count, and decrease lost time. If you can be able to triage patients and provide them with an estimate of their cost and how you're going to treat them, even show them some before or after pictures before they come into the office, imagine how many more patients you can see, how much you can reduce lost time. And you can even send them a customized recommendation, how many appointments they're needed, how much you think it's going to cost, and even send them a video. This personalized touch provides you with the ability to get additional patients in, by the way, at a higher level of cost to them or revenue for your practice, because these are not just cleanings and not just emergency, or you can use this for emergency as well, and really can help you increase your practice revenue, all while saving you time. Now your patient's in the office. It's appointment day. It's really important for you to potentially automate a few things. Number one, automate the review of the patient forms. I know that sounds strange. Communicate your check-in process, and then maybe text and chat your check-in. So if you have a patient who's using digital automated patient forms, online patient forms, the solution that we have actually provides critical care information right to the dentist, either on their screen or their iPad, or you can print it out for the dentist so that they can look at it, so you can look at it before the patient comes into the chair, whether or not they have a history of diabetes or high blood pressure, drug interactions, all of the dental types of things that you would want to know based on what they filled out in their patient information and their health history form. The system will automatically determine that for you and provide you with critical information so that you can speed the time. I will tell you, to be honest, I fill out a patient information form for so many things, a doctor, eye doctor, and I don't even know if anyone's looking at them. This way, I know you have an easy way to look at them, or your team can alert you, hey, we have a couple of yellow or red alerts here. You might want to take a look at this one. Before the patient comes into the office, you want to send them their reminder, and you can automatically send them their link to their health survey or their online questionnaire right there. And as I talked about that, within 24 hours of your appointment, here's a reminder of your appointment. Don't forget to come in. Don't forget to complete your health survey. And I've talked about the fact that sometimes practices are requiring it, and you need a system that will automatically keep track of it and provide that information so that you can remind patients automatically. I'm not sure you can see this particular screen as well. I should have had a better background, but one of the things that a lot of practices are doing is making a person wait in the parking lot, and when you're ready for them, when when their time is there, you give them a call or you have some type of interaction with them. You can use HIPAA compliant live chat to communicate with the patient that it's time for them to come in, rather than you tying up your phone or trying to call them or text them manually, remembering their phone number. You tell them all you need to do is chat me in my live chat, and then I'll let you know when to come in. How much time that speeds up. And sometimes, and I think about this a lot, that could be 30 seconds, 2 minutes that is saved. But if you look at all of these solutions and add them up, you should be able to really speed and make your process more efficient. And lastly, the post appointment. It's really important that you consider using the live chat for the post appointment. So you can chat your customers or text your customers through live chat and ask them about their question, whether or not they're okay, or do follow-ups with them. You can use the virtual consultation to do live virtual calls for follow-up. If you want to look into a patient's mouth and see how the healing is doing, rather than them coming into the office, you can at least triage it and make a determination about whether or not they need to come back into the office for any follow-up. And lastly, and probably most importantly, is online bill pay. To this day, and I have a great dentist, by the way, but to this day, they still send me a paper bill. And that paper bill, I have to send a check back, or I have to call them to give them my credit card, or as I do most of the time, the next time I come in, I pay them. They don't charge me on the day of the appointment. But online bill pay is ubiquitous in most places, except for in dental offices too often. You can deploy online bill pay, or you can use a touchless point of sale system right there in your office, and a patient can pay their bill from the convenience of your home. We have shown, and this industry has shown, that this increases you getting your money, increases the actual times, and reduces the amount of cost in you trying to get collections. And collections go up when you deploy online bill pay, either through your website, or you do it as a point of sale solution. Imagine the time saved from someone having to print out paper bills, send them out, and being able to get a paid person to fill out a check, and you open the receipts and all of that. All you have to do now is to deploy an online bill pay system right on your website, and someone can pay the bill there. Even if you want to send out paper bills, you can point them to their website to pay their bill online. I hope that you can see in this little brief presentation the number of tools that you can to not only improve communication, but to automate your practice workflow, to reduce the amount of time it takes to get a patient through your system, as well as to be able to increase your practice revenue with a small investment in automation. ProSites is here to help you with these tools. Our company has been your digital marketing partner for everyone in the dental industry for many years. And now we have been focusing on solutions to help you automate your practice, really focusing on how to help you get more revenue from your patients and make sure that your practice is thriving. And we're also providing deep discounts on our solutions to help reduce the burden on your practice, from heavily discounted startup fees to even delayed billing for some of the solutions. I encourage you to reach out to one of our reps today or this week, and we'll work with you to help you get back to the 100% practice level that you want and that you need in order to make your practice thrive. I hope you found this information helpful to you. I can take questions now if you ask them in the questions box. I'm happy to take those questions and really appreciate you taking time in this 30-minute demonstration. Thank you so much for your time. I'll take some questions now.